Next common question is bleeding gums. I have seen the patients with bleeding gums for years together, maybe 5 years, 6 years, 10 years. So what's your warning to them and how to handle the bleeding gums and different types of bleeding gums?
Bleeding gums is a condition seen because of multiple reasons. It might be because of improper oral hygiene, which leads to a condition called as gingivitis. The second one might be because of that condition which is extensive, leading into periodontitis, and the other are the systemic conditions which are like diabetes. The other one is patients who are taking blood thinners, something like ecosprin or something like anticoagulants. So these medications, when the patient takes and when there is some little amount of trauma while brushing the tooth, the gum might bleed. And other conditions such as patients who are completely on to aggressive habits such as tobacco, that is chewing, or let it be cigarettes. So these conditions also lead to some conditions such as bleeding gums. So this is because when the patient is not maintaining his oral hygiene properly, there is inflammation of the gum. That is, the gum becomes red and there is swelling of the gum. And another condition is you see bleeding gums in women mainly when they are in the carrying state, that is pregnant women, because of the change in the hormonal condition in the body, that might also lead to bleeding gums. There is an other medicine related bleeding gums. So there are few medicines which might lead to swelling of the gums, which might lead to bleeding of the gums.
As a side effect.
Yes, it is. Yeah, it is like a side effect only, which might lead to bleeding of the gums in a long-term usage of such kind of medication. So these are the issues, how bleeding gums are caused. So how to control that and how to protect your gum not to bleed. One is proper oral hygiene, that is, as I told, proper swishing of the mouth without any debris in the oral cavity regularly after food consumption. Never let any food bean stuck in between your tooth. So use proper dental aids such as toothbrush, floss, interdental brushes. Nowadays something called as water pick or water floss is also there, which helps in spraying water with a gush force into interdental area, that is in between the tooth, to remove the food which is stuck in between the tooth. The other one is when you are using these adverse products, just control the products and try to overcome the habit, will lead to a good oral hygiene. So when this condition of gingivitis is not handled properly, will lead to periodontitis, which might lead to severeness of the problem or aggravation of the problem, which will lead to collapse of the gum and bone collapse also. So brushing also should be very minimal, that is for around 2 minutes with soft or medium brush with minimal amount of force, which might not disturb your gum much and not lead to bleeding. And in conditions such as hormonal changes in women, which I just mentioned to you, at the time of pregnancy, you have to again see, whenever bleeding gums is a topic to be taught, so managing the health with the food, controlling the diet habit, controlling the oral hygiene will definitely give you good results in maintaining a good gum health and maintaining a less or decreased amount of bleeding in the gum.
Right. So the final take home message is it is not the always problem with the gum. There can be systemic problems or problems at somewhere else in the body can lead to bleeding gums. So the treatment should be locally as well as systemically in
Yes.
case of bleeding gums. And the important thing to note here is always oral hygiene is the best thing to do to avoid the bleeding gums.
Yes, and one more, as it's told, the mouth is a mirror of your body. So whatever systemic disease or systemic conditions are there will be definitely reflected into your oral cavity, which helps in getting a conclusion that there might be some issue which, when taken care properly and diagnosed properly, will give you a conclusion regarding the systemic disease also, so that your entire health of the body is improved in a better way.
Thank you, Krishna.